Are you tossing and turning at night due to unexplained fever and cold sweats? Is it painful for you to sit down and get up because of the sudden joint pain in every joint? Are you not feeling overwhelmed by little things that make you cry and getting irritated with your family? This is a warning sign that the shield known as female hormones estrogen, which has been protecting your body for over 10 years, is gradually being lifted. If you ignore and neglect this signal as simply a matter of age, menopause can become a dangerous tunnel that leads not just to a temporarily difficult period, but also to irreversible osteoporosis, cardiovascular diseases, and chronic depression for the rest of your life. Many people misunderstand menopause as a fate that must be endured. However, menopausal symptoms can be sufficiently alleviated and overcome through proactive management and personalized treatment. Today, this video will transform your menopause from a woman's second puberty to a turning point towards a more graceful and healthy life. We don't just list menopausal symptoms. The scientifically proven H.E.R. solution that maintains the role of female hormones for an additional 10 years will specifically inform you about the fatal complications that menopause can cause to your bones and heart. If you are in your late 40s, turning off this video means you will miss the opportunity to detect your risk of early menopause. Focus all the way to the end right now. Menopause, don't hide or endure it any longer. Part 1. SOS of Women's Menopause, 5 Warning Signs Your Body Sends. 1. The accurate distinction between menopause and perimenopause. Before discussing menopausal symptoms, it is important to clearly distinguish between menopause and climacteric. Menopause. It refers to the point when menstruation has completely stopped for more than 12 months, meaning the ovarian function has completely ended. Menopause refers to the entire period, including about 10 years before and after menopause, during which female hormones decrease sharply, leading to physical and psychological changes. Symptoms begin to appear during this period. 2. The 5 urgent warning signals your body sends. First, fever and sweating vascular movement symptoms. Suddenly, my face, neck, and chest become flushed and hot, accompanied by uncontrollable cold sweat. It is the most common symptom that worsens at night and disrupts sleep. Second, insomnia and sleep disorders. I can't sleep deeply and often wake up, or I wake up early in the morning and can't fall back asleep. Hormonal imbalance reduces sleep quality, leading to chronic fatigue and irritability. Third, the screams of the joints, joint pain and muscle pain. Female hormones also play a role in strengthening joint cartilage and bones. When hormones decrease, the joints in your fingers, knees, waist, and throughout your body begin to feel stiff and painful. This is the reason why arthritis rapidly occurs in menopausal women. Fourth, emotional anxiety and feelings of depression. Tears come without reason, and I feel anxious or experience severe mood swings. Estrogen also affects the central nervous system and plays a role in regulating mood. So when it decreases, one may experience emotional changes similar to a second puberty. Fifth, skin dryness and changes in the urogenital area. Collagen production in the skin decreases, leading to dryness and loss of elasticity. Symptoms such as dry vagina, dyspareunia, and urinary issues like frequent urination or difficulty holding it, as well as incontinence, may also occur. Part 2. 3 deadly complications that arise when the protective barrier disappears. Female hormones are not just simple substances that regulate menstruation. It is a lifetime shield that protects your heart, bones, and organs. You need to be aware of the fatal organ complications that arise as this protective barrier disappears. 1. The surge of cardiovascular diseases threatening the heart. The reversal of LDL and HDL. Premenopausal women have higher levels of HDL, good cholesterol, that cleans the blood vessels thanks to estrogen, while LDL, bad cholesterol levels that block the blood vessels, are kept low. However, after menopause, this ratio reverses, and the incidence of hyperlipidemia and hypertension becomes similar to or higher than that of men. Atherosclerosis acceleration, as the vascular protective effects of female hormones diminish, atherosclerosis progresses rapidly, and the risk of serious cardiovascular diseases such as myocardial infarction and angina increases sharply. 2. The fear of osteoporosis that melts bones. Calcium loss. Estrogen plays a key role in helping calcium be stored in the bones. When hormones decrease, calcium begins to leach from the bones, causing them to weaken like a sponge with holes. Silent fractures. Bone density decreases rapidly within 5 years after menopause, leading to osteoporosis. Even a minor fall can increase the risk of hip fractures or spinal compression fractures, which can pose a serious threat to life. 3. Genitourinary atrophy that causes urinary incontinence and cystitis. Organizational changes. A lack of estrogen causes the mucosal tissues of the vagina and urethra to become thin, dry, and lose elasticity. As a result, you become more susceptible to infections such as vaginitis and cystitis and stress urinary incontinence, which causes urine leakage when laughing or coughing, commonly occurs. This is the most important for women's health. If you know someone around you who is struggling with menopausal symptoms, be sure to share this video so you can both stay healthy. This information can help solve your concerns. Don't forget to subscribe and like. Part 3. Regaining Vitality. H.E.R. Solution to maintain female hormones for 10 more years. Menopause is not a period to endure. You should practice the H.E.R. Hormone-Exercise-Diet solution to actively manage and adapt to hormonal changes and regain vitality. Hormone replacement therapy, misunderstandings and truth. 1. Unconditional fear relief. There is a vague fear of hormone therapy due to some past studies. However, starting hormone replacement therapy HRT after consulting a specialist in the early stages of menopause can provide significant benefits not only in alleviating symptoms such as facial flushing and insomnia, but also in preventing osteoporosis and cardiovascular diseases. 2. Customized treatment. Depending on whether a hysterectomy is performed and considering individual risk factors, it is prescribed in the lowest possible dosage and in a manner suitable for the individual, such as oral medication, patches, or gels, so it is essential to consult with a specialist. Customized exercise to protect bones and muscles. 1. Maintaining bone density. Weight-bearing exercises such as walking, jogging, and climbing stairs provide stress to the bones, helping calcium to be absorbed into them. You need to do it consistently for more than 30 minutes every day. 2. Strengthening muscles and maintaining basal metabolic rate. The decrease in female hormones accelerates muscle loss. Strength training is essential to maintain muscle mass, which helps prevent a decrease in basal metabolic rate and protects the joints. 3. Prevention of stress, urinary incontinence. Kegel exercises. Strengthening the pelvic floor muscles through Kegel exercises is essential for alleviating urinary incontinence. Symptoms in women before and after menopause should make it a daily habit. The diet and nutrients that support female hormones. 1. Foods similar to estrogen, isoflavones. Isoflavones, abundant in legumes such as beans, tofu, and fermented soybean paste, act similarly to female hormones in the body and help alleviate menopausal symptoms. 2. The 3 key nutrients for bone health. You should increase your intake of calcium, vitamin D, and magnesium. In particular, vitamin D helps with calcium absorption and is important for immunity, so it should be adequately obtained through sunlight exposure or supplements. 3. Omega-3, the vascular cleaner. As the risk of cardiovascular diseases increases, it is important to consistently consume omega-3 fatty acids through bluefish or supplements to maintain vascular health. Part 4. 4 key management strategies for alleviating menopausal symptoms. 1. Sleep hygiene management for a good night's sleep. Night sweating management. If you experience heat and sweating at night, take a lukewarm shower 1 hour before bedtime and keep the bedroom temperature slightly lower. Wearing pajamas made of cotton material is helpful. Pre-sleep habits. Avoid watching smartphones or TV before bed and drink warm milk or chamomile tea to calm the mind and body. Having a regular sleep pattern of going to bed and waking up at set times is important. 2. Heat cooling therapy for joint pain relief. Morning stiffness. When your joints are stiff and swollen in the morning, take a warm shower or apply a hot compress to relax the muscles around the joints. After activity pain, it is advisable to apply a cold compress to reduce inflammation when joint pain worsens in the afternoon. The method of applying heat should vary depending on the nature of the pain. 3. Mind care for managing emotional ups and downs. Hobbies and relationships. Start a new hobby or engage in positive social activities to relieve emotional changes and find vitality in life. Meditation and breathing. Meditating for 10 minutes a day or practicing deep breathing can greatly help alleviate sudden feelings of heat and anxiety. 4. Warning signs that you must seek a professional for. Serious symptoms. If symptoms such as facial flushing and sweating are severe enough to interfere with daily life, or if feelings of depression and lethargy persist for more than 2 weeks, do not hesitate to consult a specialist in obstetrics and gynecology or psychiatry. Suspected early menopause. If you experience irregular periods or cessation before the age of 40, you must undergo early menopause testing to prevent complications caused by a decrease in female hormones. Part FIBA. The final message of gracefully overcoming the second puberty. Menopause is not a decline, but a turning point in life where a new chapter in women's health begins. By paying attention to the signals our body sends during this time and actively addressing them with H.E.R. solutions, we can keep our bones strong, our hearts healthy, and our minds at peace even after menopause. Don't struggle alone anymore. Even if your hormones decrease, the vitality of your life will never diminish. I sincerely support you in overcoming this period gracefully and wisely with proactive management. If you have any questions or experiences about improving vascular health, please leave a comment and I will provide more useful health information in the next video. Thank you.